Essentially, today happens to be a very auspicious day from the terms of teaching and learning. It's Guru Purnima, and no better day to have a session like this than today. Having said that, I heard the previous two talks of two esteemed speakers, Dr. Nandan and Dr. Nikhil. Both of them forgot to mention one thing, that both of them were extremely meritorious students and residents passing out of KEM Hospital. Not everyone is lucky, blessed, intelligent to come out of an institution like KEM. Also, what they said about their fellowships was that if you analyze their talks, they have spent a lot of time trying to get into the system, because this is a system-based training program in the UK as well as in Canada and maybe even in Australia. What I'm going to speak to you about is a non-system based training program which is run by CCOT. CCOT is the oldest world orthopedic organization. It will complete 100 years in the next 2 years. And over a period of time, CCOT has trained thousands and thousands of fellows from all over the world, including Africa, including South America, North America, Asia, Europe. So it is one of the more popular associations and organizations which you would want to get associated with. And believe me, it's quite simple to get a CCOT fellowship compared to what the previous speakers have mentioned. But it's not easy. Not easy because to prepare and get a fellowship or get your application through, your preparation needs to start right from your residency stage. And if some of you have completed your residency and have not been able or not got the opportunity to do the things which I'm going to tell you, please start it from today, right? So the first thing you need to do is that an Indian trainee and a trainee on the global stage are like chalk and cheese, absolutely different. Like the trainees here and the trainees abroad, or what is expected from a trainee abroad, is completely different. Right? So you need to transform, adapt and evolve into a global trainee first. Why am I telling you this? It is important and it pains me. I work in a public hospital wherein we get residents every 6 months. Many of them come from private institutes. They are post-MS. They have not invested their time, energy and efforts in scientific publications or any sort of scientific work in addition to their clinical training, right? And they say that the next thing which I wish to do is a fellowship. Now it's not that easy to get a fellowship, right? And anywhere in the world, why would someone, like Dr. Nikhil said, they have to take you seriously. Why would anyone take you seriously? Because you look good? No. Because you come from India? No. Because you come from a good institution? No. Because your father is rich? No. There is only one universal language because of which they will accept you and take you seriously, is if you have any amount of scientific validation and peer-reviewed articles in your name, not necessarily first author, right? So like to go to the US, you'll require a passport and a visa. Your passport and visa to get into any training program beyond MS abroad is publications, because that is what puts you on the comparison with someone else who has equal amount of training but has lesser number of or lesser amount of scientific experience, right? So it's very important. So build a strong foundation, build academic achievements right from your residency period. Even if it is senior residency, the time has not gone. Again, a lot of the previous speakers also said that you need to network with high scientific net worth individuals, people who've done fellowships before, people who run fellowship programs, right? People who publish, who are keen and avid publishers, who publish every 2 to 3 weeks. These are the people you need to get in touch with, right? Language skills. Okay, now I will come to the slide when I speak about language skills, but there are different kind of languages in orthopedics which I'll come to. And also, more importantly, get a mentor for yourself. Believe me, without a mentor, you are lost. A mentor is like a GPS, is a global positioning system who can actually, catapult you into the summit of scientific excellence. But you need to find the correct mentor. That is very, very important. Right? How do you build a strong foundation? Go block by block. Bedside clinical examination, very important, because even when you go abroad, you will be assessed on the basis of your clinical knowledge. Writing detailed clinical notes. There is nothing important than writing clinical notes, because when you go abroad, like you get an SHO post and you're writing clinical notes, you will be assessed whether this man is all right to become a registrar purely based upon whether you are doing your due diligence and are writing notes properly. Clinical skills, again, basic clinical examination, basic diagnosis, forget MRI, forget CT, I'm not even talking about the big things. Basic things, that is what will differentiate you from trainees coming all across the world. Because a lot of trainees coming from, say, Middle East, or even like Nandan mentioned, somebody coming from Japan, they may know the stuff, but they may not know how to express. Because you're going to be going to a English language speaking country, right? So that is your biggest advantage. Where a Japanese guy or an Arabic guy or even an Eastern European guy is going to struggle with the language. Okay, communicate with patients, because that is what is going to be looked into when you are going to continue your fellowships further. And more importantly, you need to practice the highest level of ethics and be kind towards patients as well as your colleagues. Okay, again, focusing on academic achievements, very, very important. Start with case reports, interesting cases, rare cases, document your clinical work, maintain a surgical logbook. Surgical logbook right from day one. It is going to be asked to you at every stage of your training, right? And sometimes, especially people training in Mumbai, you don't even know when you train in a public institute the kind of work you're doing. Somebody who's doing it at a fellowship level, you're doing it at a registrar level. So please have a very strong logbook and start presenting your work at conferences and courses, because that is where you will find your mentor. That is where you will find somebody who is willing to not only help you out, but will also become your life mentor in the future. Now, networking with high scientific net worth individuals, again extremely important. People who have a lifelong commitment and inclination towards academics. Like when I was doing my residency, there were a lot of people in KEM who today are the topmost guys. Dr. Manish Agarwal, Dr. Dinshaw Paradiwala, Dr. Meher Bapat, Dr. SS Mohanty, to name a few, who are at the top of their game today. And just by interacting with them, speaking to them, listening to them, or even trying to emulate them or copy them, blatantly copy them, we were able to reach somewhere, not at that level, but somewhere. So please try and find such people in your institutions and seek counsel for them. Don't even feel shy to approach somebody if you need help, because they will guide you into the world of academics and will also stimulate your interest. Believe me, working in KEM, looking at these guys presenting in conferences really gave us a big stimulus to go ahead and grow. And that is how we have progressed. Now, coming to language. Language in orthopedics or in medicine has subtypes. There is an academic language which you will use in conferences. There is a clinical language which you will use in the ward. There is a scientific language which you will write papers, and there is a spoken language which you will communicate with your patients, right? So you have to be a master of all these four languages. All these languages are totally different, but please remember and understand that these are very, very important to understand, and there are subtle differences. But these subtle differences need to be picked up, and you need to develop all these over a period of time. Language skills, again, English, because everybody looks at an English score before they accept you. You have to know English. Like Dr. Nandan said, somebody missed an opportunity to do a fellowship because his English was not good. So there are short courses, multiple short courses online and offline. In addition, also reading up literature, okay, journals, medical books, that will also help you in developing or learning certain words which you can add to your scientific vocabulary, right? And that will help you converse not only with colleagues but even with seniors. There are exams like the TOEFL or the IELTS. Now, I have not given either of them, so I wouldn't know more. There are other guys who would know more. But yes, a score in these is also expected when you apply for your CCOT fellowship. The next thing is seeking mentors, and I'll go a little fast here. There are three kinds of mentors: life mentors, academic mentors, and institutional mentors. Essentially, the institutional mentors are those who work in your institute, who inspire you and make you realize your potential. An academic mentor will model you into a dynamic academician and help you rise above your level of expectations. And a life mentor is somebody who you can meet at any point in time, discuss issues, clinical, non-clinical, and they help you set up your practice and elevate you into the orbit of excellence. So, to be a trainee on the global stage, before you actually apply for a fellowship, you need to build a strong foundation, focus on academic achievements, network with high scientific net worth individuals, develop impeccable language skills, and actively seek mentors for recommendations. Please take a picture of this, because this slide is probably the most important slide in your life, at least during your training period. Trust me, this is the way almost everybody who I know has done further training has gone into. Right? Second player. Now let's get specific with the CCOT fellowships. So what is a CCOT fellowship? A CCOT fellowship is a short or a long term, not a long term but a medium term training opportunity which CCOT provides you. Now what do you need to be to apply for a CCOT fellowship? You need to be a CCOT member for 2 years, right? That makes you eligible for application. Now once you apply, right, then there are certain things which you need to complete. So 150 euros a year is what you need to become a CCOT fellow for 2 years, and you become eligible. There are two types of fellowships: long-term fellowship and short-term fellowship. Maximum fellowship is 1 year, not more than that. So either 4 to 6 weeks or 6 to 12 months. Now, this fellowship is not meant for you to migrate to that country. This is a purely training opportunity, a short term or a long term. One, either you wish to hone your skills into a particular subspecialty, or second, you want to start a subspecialty practice before which you want some amount of foreign experience. So this is the difference. You are not going to migrate into that country. Please don't be under the impression that if you do a CCOT fellowship for 6 months in the US, you will get into the US. No. The channel to get into the US is what every fellow has to follow. But this is a good opportunity for you to hone your subspecialty skills and then try and practice as a subspecialty surgeon. So there are various different kinds of fellowships. The most common is the CCOT meets CCOT fellow, wherein there is a CCOT member who runs a fellowship in a particular institution. Typical duration is short, it is 4 to 6 weeks. Funding is up to 2,500 euros, and there are about 50 positions all over the world which are available. So for example, if you want to learn something very niche, like I wanted to learn hip preservation, so I went to the Texas Children's Hospital as a SMS fellow or a CCOT meets CCOT fellow in 2020, and I was able to learn from Dr. Scott Rosenfeld the nuances of hip preservation, though I was an established pediatric orthopedic surgeon even then. The next is the Ganga Hospital Fellowship, which is about 4 weeks for 4 fellows, 1,500 euros. Then there is a APOS CCOT Fellowship, 2 to 3 weeks, 1,000 euros and 2 positions. APSS CCOT Spine Fellowship, about 3 weeks again, 2,500 euros and 2 positions. And then there is something called as German CCOT Fellowship for 4 weeks, which is 2,500 euros travel and accommodation. It is given to people who stand first and second in the Diploma CCOT exam. So there is something called the Diploma CCOT exam, which is conducted every year. The theoretical part of it is held online. The practical part of it is held during the Congress, wherein you are interviewed by a panel of examiners. And if you pass that exam, and if you stand first or second, you get to travel the German CCOT, and I know two people from India who have done it. Dr. Vaibhav Bagadia was the first one in the first year when this exam was started, and then Dr. Akash Saraogi. So both of them have cleared this exam, and if they can, so can you. Okay, then there are some long-term fellowships. Again, positions are limited, but still you can get them. There is a TCH, that is a Texas Children's Hospital CCOT research program, 12 months, 56,000 per year US dollars salary plus a plane ticket. Position is one. This is only a research fellowship. Then there is a CCOT international traveling fellowship for 3 months, 4,000 euros, one position. CCOT Danish travel fellowship, 3 months, 2,500 euros, one position. The Shenzhen fellowship, 1 to 2 months, up to 1,000 euros, 10 positions. And the HKU fellowship, which is in Hong Kong, again 12 weeks, 600 euros plus daily allowance plus 100 Hong Kong dollars. It is again 2 positions. So requirements essentially are, you need to be a CCOT member for 2 years, your age has to be below 45, good language skills, a good CV and a full immunization history. What do you expect in a short-term fellowship? A brief overview of the specialty, observing surgeries, observing patients in outpatient department, learning novel techniques and refining your technical skills, and an opportunity to network and establish contacts, which is very important. Long-term fellowship, deeper perspectives, washing up for surgeries, learning the art of clinical examination and patient care, which is different from country to country. Develop new skill sets over a period of 1 year. Write and publish papers, which is extremely important in your subspecialty. And an opportunity to develop long-term relations with mentors with whom you can interact on different forums and who will become your role models. So how does this committee choose the fellow? So in addition to being the CCOT national representative, I am also a member of the CCOT fellowship committee. So how do we choose fellows? Okay, the age has to be below 45. We see your years of experience, at least 5 years of experience post-MS. There is a big emphasis on publications and awards. Logbook, at least 100 cases a year. Again, I mentioned, very important. Letters of recommendation from 2 prominent surgeons of your country. Letters of introduction, this is very important. It is almost 10 marks on why should I get the fellowship or why do I wish to do the fellowship, right? So very, very important to write a good letter of introduction. Subspecialty interest, and how is it shown? By your publications. If you have a publication in a particular subspecialty, it shows that you are interested in that particular subspecialty. Proficiency in English. And last but not the least, CCOT membership and attendance of CCOT congresses. So if you attended 2 CCOT congresses, you can get 10 points, And a lot of people don't do that and they lose those 10 points. Right? So this is an easier way of getting through. What happens if you're selected? The chair of the committee will forward this application to the center. The CCOT mentor at the center will evaluate your application and then would do the further documentation, will ask for a valid passport, letter of financial support, because you need to partly fund this, partly it will be given by CCOT, your immunization certificate, your blood work including your serological markers, chest x-ray, very important, specific medical history and approximate dates on which you wish to travel. These have to be known, right? Once you enter the center as well, before you start your fellowship, it's not that you go into the OT and just start washing up, right? So you require security clearance, submit your documents, you will be given an orientation trip, you will be given a daily plan during the duration of your fellowship, you will have discussions with your mentor as to what exactly you need, based upon which your schedule will be decided. You will have a rotation in the wards, OT and the clinic, and you will discuss research projects. So this is how a typical short-term or a medium-term CCOT fellowship goes to. This is my experience with the hip dysplasia unit, CP unit, hand unit, spine unit at the Texas Children's Hospital. It was a fellowship for a period of about 3 weeks. A wonderful experience to share with all of you. If you're looking to do a niche, learn a niche surgery or a niche procedure. So what are CCOT fellowships about? These are short-term fellowships. These are about learning, these are about evolving, but these are also about enjoying. Having said that, you need to make yourself worth and to be considered serious, to be taken up as a fellow, and I have already mentioned to you what needs to be done. I wish you all the best, and if there are any questions for you, I'm willing to take them right now. I would also urge and request all of you all to become members of CCOT. You can be members of CCOT only if you're post-MS, right? But the first and most important thing to apply for a fellowship or a training opportunity is that you have to be a member of CCOT, right? And you can slowly rise up the ladder in CCOT, eventually becoming a faculty, eventually getting into a committee, eventually becoming a member of a scientific committee, a chair of a scientific committee, and someday if you're lucky and if you work hard enough like Professor Johari or Professor Rajshekharan, then you can also be the president of CCOT. Thank you so much for your wonderful presence